Hello, everyone, and welcome back to another chapter of Flight Physiology and Human Factors. In this chapter, we are going to take another look at the physiology and anatomy of the inner ear as we look into spatial disorientation. So, our objectives for this chapter are number one, to define spatial disorientation and list the sensory systems in the body that contribute to our sense of spatial orientation. So, it's not just going to be the inner ear, there are other aspects of human physiology, including your eyes and your proprioceptors, and then also your auditory portion of your inner ear that is going to contribute. But by and large, we are going to talk about the vestibular part of human sensory systems. So we're going to secondly describe how changes in body position and aircraft attitude affect the hair cells of the vestibular apparatus. Number three, we're going to explain the most common vestibular illusions that are experienced while in flight and relate them to inner ear function. And then finally, we want to be able to describe the most effective strategies for combating spatial disorientation in flight. So, spatial disorientation refers to this misperception of your own body's orientation in space and with respect to the position of the aircraft in space. So, another way of putting this, it's having a less than accurate perception or idea of your aircraft's position or attitude, what the pitch is like, what the bank is like, what the yaw is like. The aircraft's heading, what direction it's going, how fast is it going. So spatial disorientation is getting these things wrong. You think you're right, but you're actually wrong in reality. And the reason is because of inadequate or incorrect information that is provided to your brain by your senses. So hopefully you've come to appreciate in this class that the human body is a amazing, sophisticated machine that just it's easy to kind of be in awe of how incredible our own bodies are and what they're capable of. But the amazing thing about our senses is how easily they're fooled. We've already seen that with visual illusions back in chapter 5. We've seen all sorts of ways in which the body just doesn't get things right. We just have this ability or inability to accurately capture what reality is. So the sensory systems in our body, whether it's your eyes, your ears, your nose, your mouth, or whatever, just have this incomplete ability to get things right all the time. So the simplest way of thinking about spatial disorientation, to put it most simply, the inability to tell which way is up. So it's like I said in the chapter objectives, it's not just your inner ear that's going to contribute to your sense of spatial orientation. So it's the visual side of things. Like the visual side of things is a big part of things, okay? So seeing what's around you is a very large component of how you use your brain to get a sense of where you are and what position your body is in. So it's not just the visual, but also the somatosensory or proprioceptive. So we'll talk more about proprioceptors and somatosensory modalities later in this chapter. The vestibular systems, and then also the auditory systems working together. So all these sensory systems working together help us to have the accurate sense of our body orientation in spaces. So are we standing right side up? Are we upside down? Are we looking left? Are we looking right? So what's going on with our bodies with relation to the space and the environment that's around us? So this lecture is mostly going to focus on the somatosensory and vestibular contributions to spatial orientation. We already have a pretty good idea of the visual components based on what we learned in chapter 6, I think it was. But we will have a chapter later on in the semester specifically on visual illusions. I believe that's going to be chapter 12. So, like I said, this lecture is mostly going to focus on your somatosensory input and your vestibular input. So we're going to learn all about the physiology that underpins those sensory systems. And then we'll also learn about a lot of the illusions that can be created when these systems are not in agreement with one another. Just to give you a little bit of an example, what happens when you're flying in IMC conditions, or what happens if you're flying in clouds, or what happens if you're flying late at night when your visual systems are not providing you with all the information that you may need. Well, what we're going to see is that your brain is having to fill in some of that missing information with components from these, and these components have a tendency to be fooled, like we said before. So in chapter 7, we really only examined the auditory portion of the inner ear. So that included the snail shell looking cochlea, and then the cochlear branch of the vestibular-cochlear nerve. So you can see your cochlear branch here coming directly off of those sensory hair cells that are in the scala media of the cochlea. So we learned all about how fluid movement within the cochlea, when sound vibrations hit the tympanic membrane and then get that vibration transference from auditory ossicle to auditory ossicle, and then we get that fluid moving in the inner ear. That excites those hair cells. It bends those little kinocilia and stereocilia, and when those little hair cells bend back and forth with the moving fluid, that stimulates electrical signals being sent to the brain. Now, thankfully, in this chapter, we're going to be focusing on a sensory system that works very, very, very similarly, okay? So we're going to be focusing, instead of the cochlea, which again is for hearing, we're going to be focusing on what's called the vestibular apparatus, which consists of several structures, including these little loop structures, which are called the semicircular canals. But the thing to keep in mind, like I said, the sensory mechanism is going to work very similarly. Our sense of equilibrium and balance and spatial orientation using the vestibular apparatus is going to be based on fluid moving back and forth within these cavities and getting those hair cells bending back and forth. So, like the cochlea, the vestibular apparatus contains fluid-filled cavities, and that fluid is called endolymph. And this fluid-filled cavities and then collections of sensory hair cells that serve to excite and communicate through the vestibular branch of the vestibular-cochlear nerve. So if we go backwards here for just a second, you have the cochlear branch here and then the vestibular branch here. So you see the vestibular branch comes from all the sensory centers in the vestibular apparatus, including the semicircular canals and then two other structures that we will define a little bit later. So each of the three orange ovals that you see on the left side here, so here, here, and here, these are called sensory ampulla. So these ampulla contain the sensory hair cells that protrude upward into a unique structure called the cupula. You're going to see a picture of the cupula here in just a second. It kind of looks like an onion that's sticking up into the endolymph. So this onion can kind of move and sway back and forth as fluid is moving through those cavities of the semicircular canals. So these ampulla specifically refer to our three semicircular canals. So when we get fluid moving through one of our semicircular canals, that fluid will move across the cupula of that particular ampulla for that particular canal. So we have three semicircular canals and three different ampulla, one for each of the canals. And then in addition to the semicircular canals, which respond to angular accelerations, the vestibular apparatus also contains two extra structures, which are called the utricle and the saccule, and they respond to linear acceleration. So the utricle and the saccule also contain sensory hair cells, but they are not organized into an ampulla or a cupula like we see with the semicircular canal. So we'll see more of that later. So the cupula and the hair cells that it contains, and you can definitely see this thing looks like an onion, so I think that's a pretty that's a pretty apt comparison. I think that thing looks exactly like an onion. So the cupula and the hair cells it contains will experience the same acceleration forces as they move through the flowing endolymph in the semicircular canals. So when you move or rotate in a given direction, the fluid in that particular cavity is going to swish back and forth, and that cupula is going to swish and sway along with it. So each of the three semicircular canals, as I mentioned before, contain ampulla and cupula that communicate to the brain about acceleration forces in that particular directional plane. Now, if you look at the semicircular canals here, they are all oriented approximately at 90-degree angles to each other. So ideally, they are oriented in three-dimensional space about each other so that one of those canals will give you information about your acceleration in the X plane, one in the Y plane, and then one in the Z plane. And then the reason why this is so relevant to flying an airplane is because when you are adjusting your airplane's attitude, you do that in three different planes. You can adjust your ailerons to adjust your bank and your roll. You can use the rudder to adjust the yaw. You can use the elevators to adjust your pitch. So when you adjust the attitude of your airplane in one or all of those three different ways, that is going to get that fluid moving through your semicircular canals. And because that will stimulate the sensory hair cells of these cupula that are in your semicircular canals, that is going to give you the feeling, the information going to your brain that has to be interpreted. That is going to give you the sensation and feeling of rolling to the right, pitching the nose upward, yawing to the left and yawing to the right. So for linear accelerations that are going to involve the utricle and the saccule, like I said, you still have hair cells here that are going to respond to movement of the endolymph fluid, but there's a slightly different mechanism at work. Like I said, you're not dealing with a cupula or an ampulla here. So instead, you have your sensory hair cells covered by a membrane called the otolithic membrane. So this lays on top of these sensory hair cells in the utricle and the saccule, and this membrane contains embedded calcium carbonate crystals, which these crystals are sometimes called otoliths, which is why this is called the otolithic membrane. So the reason, and for this reason, the utricle and the saccule are collectively called the otolithic organs. Now, you're probably thinking, basically the idea here is that you've got rocks in your inner ear, okay? So your utricle and saccule, basically these membranes have rocks sitting on top of them. That's basically what these otoliths are, these calcium carbonate crystals. So the otoliths, or rocks if you want to think of them that way, they basically are sitting on top of this otolithic membrane, and they serve to weigh down the membrane on which they rest. And the interesting thing here is that when you tilt your head forward or backwards, these crystals are going to redistribute in the direction of the tilt. So these crystals, being heavy, are very subject to gravity. So if you tilt your head backward, the crystals are all going to kind of move down towards this end of the membrane and kind of weigh down that end. And when that happens, that's going to pull the fluid that is inside here in this direction and get those hair cells moving in that direction. If you tilt your head forward, all the crystals will distribute this way with the force of gravity. That'll pull the fluid and pull the hair cells in that direction. So the physiology is a little bit complicated, so I'm not going to get into it too much, but the actual physiological and electrical behavior of these hair cells will be different depending on which way those hair cells bend. If they bend this way, they will produce electrical signal A, we will call it, and the brain will interpret that as you're tilting your head back. If they tilt in the opposite direction, then they will produce a different kind of electrical signal that will be interpreted by the brain in a different way. So in that case, your brain would have the opposite interpretation, which is that you're tilting your head forward. So as you can kind of put together here, this is going to produce the sensation of I'm looking up or I'm looking down. So these are linear accelerations, looking up and looking down and tilting your head forward and tilting your head back. And we use the utricle and the saccule and these otolithic organs for those sorts of sensations. But for rotational acceleration, turning your head and feeling your body turn in three-dimensional space, you're going to use the semicircular canals for that. So ultimately, the thing that I want you to remember here is something that we talked about in the previous chapter when we talked about g-forces. Acceleration refers to a change in velocity in a given direction. You are only going to feel acceleration forces. So if you're in an aircraft that's traveling 400 miles an hour, you're not going to feel as if you're actually moving if the airplane is not accelerating in any particular direction. If the airplane maintains an absolutely constant speed or velocity of 400 miles an hour and never deviates from that, you are never really going to feel as if you are moving. Now, if the airplane accelerates from 400 to 500 miles an hour, then that speed up or that change in acceleration is something that you're actually going to feel. When the airplane puts on the thrust and you start going faster and faster, you're going to feel that acceleration. You're going to have the sensation of being pulled back in your seat. And the reason you're going to feel that is because of your otolithic organs. Those calcium carbonate crystals redistribute back in this direction, and these hair cells bend in that direction, and that stimulates these sensory nerve fibers to send that information to your brain about the sensation that you are feeling. Now, why is this important? Why is it important to re-emphasize that we only feel acceleration? We don't feel velocity, we feel acceleration. Well, the reason is because, like I say, these sensory organs only really respond to accelerations. So when a steady state is reached, meaning that acceleration stops, the hair cells are naturally going to straighten out. And when those hair cells are standing perfectly straight up, the signals being sent through your vestibular nerve to your brain are no longer being sent, okay? So if you accelerate to 500 miles an hour and then you stay at 500 miles an hour, your hair cells are going to straighten out and you will no longer experience the sensation that you are speeding up. Okay, so this is an important thing to consider. Once you reach a steady state in which you are no longer accelerating, you stop feeling the acceleration. So that's kind of easy to conceptualize if you're talking about linear acceleration, but rotational or angular acceleration is a little bit harder to visualize. So say that you are in a prolonged and constant turn. So you're banking by 20 degrees and you stay in that 20-degree banked turn for like 20 seconds, and you are just constantly banking at the same angle and the same angular velocity the whole time. Well, initially, when you start that turn, you're going to feel that angular acceleration. You're going to feel that in your semicircular canals. That is going to cause the cupula to start bending with the movement of that endolymph fluid. So naturally, when you're not turning and you're maintaining level flight, the cupula is straight up, those hair cells are straight up. No turning means no sensation. Now, when you start the turn and you first start that bank turn, you will have the sensation of, oh, I am rotating, I am turning to the right, because you are moving that fluid in your semicircular canals and you're getting that cupula to move and you're sending information to the brain. But if you stay in that bank turn for too long, the acceleration is not really acceleration anymore, so things kind of catch up with it, and the fluid starts moving at the same speed and rate as the actual walls of the inner ear. So the fluid really stops deflecting the cupula, and you no longer have the sensation that you're turning. So if you stay in a banked turn for too long, you will eventually get to the point where you start feeling as if you're in level flight, even though you are still in that banked turn. And the reason why that can actually be kind of dangerous, and we'll discuss this here in a minute when we start discussing what's called the leans, when you actually come out of that banked turn, so let's say that you're in that banked turn for 20 seconds, you start feeling as if you're maintaining level flight, but then you look at your instruments and see that you're still in that banked turn. So you turn back to the left to get yourself back to level flight. Well, the problem here is that when you turn back, that is an acceleration that you're going to feel, and the fluid is going to move in the opposite direction through your semicircular canals, and you're going to deflect the cupula and the hair cells in the opposite direction. So even though you've readjusted to get back to level flight, now you're feeling like you're banking to the left, even though you really aren't. So this is going to be a very consistent theme throughout this chapter of this kind of spatial disorientation of feeling like you're turning when you're not and feeling like you're in level flight when you're not. And it's all because of the limitations of these sensory vestibular structures in terms of how they are excited and what they respond to. Okay, so as I mentioned, vestibular sensations are not the only way that we maintain our sense of spatial orientation. We also need to talk about what's called proprioception. So, as I said, the two most important sensory systems for maintaining spatial orientation are arguably the visual systems and the vestibular system. So, if you have both your vestibular sense of spatial orientation and clear visual picture of where you are and what you're around, if you've got visual landmarks and you're flying in visual flight conditions, then you're very unlikely to experience spatial disorientation. But if we had to add in the third ranked most important sensory system for maintaining spatial orientation, the third would be our proprioceptive or kinesthetic systems. This is sometimes also called somatosensory systems. So this consists of sensory receptors all throughout the body, so all in your skin, in your muscles, in your joints, in your connective tissue, your tendons, and your ligaments. And these sensory systems respond to gravity, tension, and linear and angular accelerations, okay? So you feel this when you are standing up, okay? So you know what it feels like to be standing up. So what's going on is when you're standing on the ground, you can feel gravity pulling you down, and that gravity places tension in your muscles and in your joints. So those joints, or those sensory fibers that are in your joints, your muscles, and your skin, they have nerve fibers that go into your spinal cord and up your brainstem and up to your brain to tell your brain and give you the sensation that you are standing up, or you're standing on one leg, or you're upside down, or you're laying down. So the sensation we have about body position that does not relate to vestibular function or visual function usually is going to come from these proprioceptive modalities. Okay, so we've covered a lot of the basic physiology of how spatial orientation is maintained. And again, this is not a rote human physiology class. This isn't really a science class necessarily. So we're not going to go into the nitty-gritty detail, but basically, the way we get information about the things that are around us is that a sensory organ sends a message to the brain, okay? So you have to have a nerve to send a message to the brain. The eyes send messages to the brain through the optic nerve, and we covered back in chapter 6 how that all works. The ears send information to the brain both for the things that we hear and through the vestibular functions that we just talked about. And then for somatosensory, you've got sensory receptors in your skin, your joints, and your muscles that send information to the brain. So the brain has all this processing power and receives all these sensory inputs, and that's how we're able to have this sensation of our body being positioned the way that it is. And if all of these systems are working properly and we've got all the information at our disposal, there's really no reason why we ought to experience spatial disorientation. So like it says here, it will be very difficult for you to be fooled into a state of spatial disorientation if you have all that information at your disposal. So a clear, visible day, you have input from all your sensory systems, you've got visual landmarks to look at, visual references, it's VFR flight rules. So very difficult to get into spatial disorientation on a clear, bright day. Now, when visibility is limited, like it would be in instrument meteorological conditions, the lack of visual inputs can create a number of vestibular and somatosensory illusions that you should be aware of. So if you take away that visual information, you're taking away a lot of what your brain relies on to establish your sense of where your body is with respect to the space that's around you. So what your brain will naturally try to do is fill in that gap of information with other pieces of information, like what is coming from my muscles and joints and skin, what's coming from the inner ear. And that's all fine and dandy, but each one of our sensory systems has limitations associated with it. So this is how we can get spatial disorientation. Because of the limitations of vestibular and proprioceptive function, we can get these illusions that we're going to talk about. So there are generally three varieties of these spatial disorienting illusions. You have somatogyral illusions, which involve the semicircular canal, so that's going to be in relation to angular accelerations. You have somatogravic illusions, which involve the utricle and the saccule, so those are going to be linear accelerations. And then you have oculogyral and oculogravic. So this is kind of a combination of vestibular and visual illusions. So again, this is usually going to happen when you're flying in limited visibility, but this is going to be a case where some of the vestibular limitations have some unfortunate synergy with some of the visual limitations that you get when flying with limited visual references. Okay, so the first and probably most common and most famous somatogyral illusion we're going to talk about is called the leans. So the leans, like I say, is very common. This is a vestibular illusion that results from the hair cells in the cupula. So again, we're talking about the semicircular canals since we're talking about cupula, being unable to detect rolling or banking motion below a threshold of 2 degrees per second. So we're talking about a very, very, very subtle bank to the left or bank to the right. So this banking, because it falls below the threshold of what is necessary to actually bend or deflect those hair cells in the cupula, this is going to go unnoticed by your vestibular senses. So there's no bending of the hair cells. You don't notice that you're banking. You have the sensation that you're maintaining level flight, but it will be noticed with your eyes if you happen to take a look at your instruments. If you look at your artificial horizon, you're going to see that your attitude has changed ever so slightly and that you're banking in a particular direction. So what's likely is that when you actually adjust your flight controls and work the yoke to correct your attitude, you're going to bank in the opposite direction more forcefully than you did accidentally to get yourself into your situation to begin with. So you're going to bank in the opposite direction at a rate above the 2 degree per second threshold. And now this actually will cause the cupula's hair cells to bend. So when you correct for this change in heading, this is now going to give you the feeling as if you're banking in the opposite direction, even though you have gotten back to maintaining level flight. So that's going to be a sensation that you have to fight against. You looked at your instruments, you know that you were banking to the left to begin with, and then you bank back to the right to get back to level flight. So you know you're at level flight, but you have the sensation that you're banking to the right. So not to give too much away, but one of the main takeaways from this chapter is essentially going to be that you need to trust your instruments. You need to trust your instruments over what you're feeling. And hopefully what you'll take away from this chapter is that the way you're feeling is not always reflective of reality, okay? So again, correcting for the change in heading will now cause you to feel as if you are banking in the opposite direction compared to where you were banking before, despite the fact that you're actually maintaining level flight. So if you go with that feeling that you're now banking to the right, you're going to want to bank back to the left, and that's going to get you back into your original left bank that you didn't want to be in to begin with. So again, trust your instruments here. Another complicating issue here is what's called the head tilt reflex. This can exacerbate the severity of the lean since it's the natural tendency to want to align our head with the perceived horizon rather than with the vertical axis of the aircraft. So if you're banking to the left, then it's natural that you're going to want to tilt your head to the left so that you feel like you're looking at a straight horizon. So that can exacerbate the leans, because when you tilt your head like that, that's going to get fluid moving through your semicircular canals, so that when you get back to level flight, that's going to produce even more disorienting feelings that you're going to have to deal with later. Okay, so as we mentioned before, prolonged turns or banks will stop feeling like turns and banks if you stay in them long enough, because of the tendency of the hair cells to straighten out when the angular acceleration stops, because the speed of the endolymph fluid catches up with the actual motion of the walls of the semicircular canals. So if you stay in a bank or in a turn long enough, it's going to stop feeling like a bank or a turn. So this we're talking about is called the graveyard spin or graveyard spiral. So the idea here is that when you go into that initial spin or that initial turn, that is going to move the endolymph fluid, and you will deflect the cupula, and you will feel as if you're moving or spinning in that particular direction. But if you stay in that turn or that spin long enough, you'll start to feel like you're just maintaining level flight, because of, again, you stop feeling the acceleration because there is no longer any acceleration. You're just turning at a constant rate with constant velocity and no acceleration. So even though you are continuing to turn, you start feeling like you're going straight. Now, when you decide to stop turning and you kind of go back to maintaining level flight, then you're going to feel like you're now turning in the opposite direction, because you went from feeling like you're level even though you're turning, now you're turning back to the right, and now even though you are flying straight, you feel like you're turning to the right. So again, this is the leans that we were just talking about, but the problem with the graveyard spiral that we're going to discuss here is that feeling of, oh, I know I looked at my instruments, I know that I'm going straight, I know that I'm maintaining level flight, but I feel like I'm turning to the right, and it's just so natural to want to put more stock in what you're feeling versus what the instruments are saying. It's like, hey, it's my body, I know what I'm feeling, right? So even though you feel like you're turning to the right, like the flight instruments say you're flying straight, right? So you feel like you're turning to the right, so it's kind of this natural tendency. You want to turn back to the left to get yourself to stop feeling that. So if you turn back in the opposite direction, you will then get back to feeling like you're flying straight, but now you're again spinning in a particular direction. And on Blackboard, I posted a number of different case studies or historical cases of airplanes crashing because of the nature of this kind of spatial disorientation. So you might want to look into those. Those are good resources to look at to kind of give you a better idea of how common of a problem this spatial disorientation is. Okay, so a little bit more on the graveyard spin and graveyard spiral. So in an unnoticed bank, the aircraft will lose altitude due to the loss of lift. We talked about this back in chapter 8, right? So this is why you pull up to 2 Gs in a bank turn. So a 60-degree bank turn will cause you to pull 2 Gs in the Z direction. So we know from the previous chapter that when you bank, you're going to pull Gs, because when you turn, you're generating less lift with your wings and you're having to pull back on the yoke to maintain level flight, right? Well, if you're not pulling back on the yoke, then when you turn, your airplane is going to lose altitude because of the loss of lift. So a pilot's natural instinct here would be to pull back on the yoke to regain altitude. So that's why you pull up to 2 Gs in a bank turn, because you pull back on the yoke to keep your altitude, right? However, without correcting the bank as well, this will cause the bank to become tighter and tighter and cause a further and further loss of altitude. So that kind of relates back to this graveyard spiral. So when you're in that bank turn, even though you may be in the turn long enough so that it feels like level flight, well, you're still going to be losing that altitude and you're still going to want to pull back on that yoke. But if you're just pulling back on the yoke to correct the altitude, but you're not also correcting the bank, this turn becomes tighter and tighter and tighter, and you can kind of get the idea of why this is called the graveyard spiral. So attempting to recover from the spin or the spiral will cause you to, again, perceive a spin in the opposite direction, which is difficult to reconcile if you have no outside visual references. So the graveyard spiral is not usually a problem if you're flying during a clear day with VFR conditions. So you may be feeling a particular way, but you can just look outside and see that, oh, well, like I can look at my visual references and see that what I'm feeling with my vestibular senses doesn't exactly line up with reality. But the graveyard spiral is a very challenging thing and a very real threat as far as spatial disorientation goes, if there are no outside visual references. So trying to correct for this feeling can exacerbate the spin in that original direction. And as we said, if you're only trying to correct altitude by pulling up on the yoke, that causes that spiral to tighten up and become faster and faster. Okay, so let's move on to what's called the Coriolis illusion. This is the second most common vestibular illusion after the leans. So this involves engaging the cupula of an unrelated semicircular canal following a prolonged turn or bank, resulting in an illusory sensations of pitch and roll. So the idea here is that you turn into a bank and you start feeling fluid moving through one of your semicircular canals that accounts for your banking motion. But then while you're banking, you tilt your head forward or you bend down to pick up a pencil on the ground or something like that. So that will get fluid moving in a different semicircular canal that otherwise wouldn't be engaged. So that will start causing a lot of conflicting sensory functions that you're going to be feeling. So when you come out of that bank, you're going to have sensations of either pitch or roll. So when you come out of that bank, depending on which direction you moved your head, you may come out of that bank and feel like you're gaining altitude or you're nose down or you're banking in a different direction. So this is called the Coriolis illusion. So to avoid the Coriolis illusion, and we'll cover this later in the chapter, it's generally recommended that when you are adjusting your aircraft's altitude, that you refrain from any abrupt head movements to make sure that you're not getting too much fluid moving in those semicircular canals. Okay, so those are the somatogyric illusions. So let's talk about the somatogravic illusions now. These are going to be the ones that involve the otolithic organs, the utricle and the saccule. And because these organs detect linear accelerations rather than the angular or rotational accelerations detected by the semicircular canals, the nature of these illusions is going to be a little bit different. It's not going to be so much about rotation and banking. So somatogravic illusions also involve the body's proprioceptors, and these illusions typically deal with your sense of climb or descent. So again, not really a case of spin or roll or banking, more of linear acceleration. Okay, so the first somatogravic illusion we're going to talk about is called the false climb illusion. This occurs most prominently during your initial takeoff in the absence of sufficient outside visual references. So you're either flying in IMC or you're flying at night, okay? So what happens here is the utricle and the saccule, your otolith organs, fail to distinguish between linear accelerations, such as accelerating down the runway prior to takeoff, and the sensations associated with tilting your head up and down. So those sensations to your otolith organs are going to feel and be treated exactly the same way. In other words, without your outside visual references, these very different actions are going to feel identical to one another. So that might seem kind of silly if you're used to only flying during the day, but if you're flying without any visible outside references, the feeling of tilting your head up and down and then taking off down the runway actually end up being very, very similar. So your proprioceptors are responsible for what's sometimes called the seat of your pants feeling of gravity as you fly at a constant speed. Now, we just said that you can't feel acceleration if there is no acceleration. So if you're flying at a constant speed, there is no angular acceleration, but there is the linear acceleration due to gravity. So you can feel, if you're sitting in an airplane, you may not feel yourself flying forward, but you can feel the weight of your body pushing down and being pulled down towards the ground. So that is not a vestibular feeling, that is a proprioceptive feeling. Again, your vestibular function cannot feel anything except acceleration. Now, your proprioceptors can feel the weight of gravity as you sit on your seat. That sitting in your seat puts tension on your muscles and on your joints that you can feel, and it produces this sensation of you being pulled downward. But again, proprioceptors cannot distinguish gravity from linear accelerations. So the issue here is that when you're accelerating following takeoff, you can be fooled into thinking you have a nose-up attitude based on the resultant gravity and inertia vector making you feel as such. Now, that statement right there may have sounded like a whole bunch of gobbledygook, so let me explain. So if you're flying at cruising altitude and you're maintaining a constant speed and your nose is perfectly level, you're not gaining or losing altitude, you're not going to feel like you are nose up or nose down because the only force vector that's being applied to your body is gravity, which is pulling you straight down. But if you start accelerating, you're still having that proprioceptive feeling of gravity pushing straight down. And because you're accelerating, the inertia is pulling you backwards. So you're pulling G's in this direction back here. And the way vectors work is that vectors add together. So you feel yourself being pulled down while you're being pulled back. And if you split the difference, the overall feeling that you feel is that you're being pulled back at this angle back here, which is going to make you feel like the nose of the airplane is up, even though it actually is not. So if gravity is pulling you back at about 30 degrees, pointed down that way, you're gonna feel like you're accelerating upward, which will make you think that your nose is up, even though it actually is not. So the reason why this illusion is dangerous is that if you have just taken off and you are accelerating, you might feel like the nose of the aircraft is up and that you need to pull it back down. Well, if you do that, you run the risk of crashing the airplane into terrain if you have not gained sufficient altitude. So it's important to account for this illusion so that you don't do something like crash into terrain, but also so that you don't overcorrect for it and enter into a state of aerodynamic stall if you try to pitch the nose up too much. So it's good to be aware of this, but you don't want to be so aware of this that you think, oh, well, I feel like I'm pitching the nose upward. I know I'm really not, so I better pitch the nose upward for real to make sure that I don't succumb to the false climb illusion. Well, if you start climbing too fast, you might stall and crash anyway. So definitely something to be aware of here. So in Chapter 8, we discussed the load factor that is applied to the airframe and to the pilot operating the aircraft when you enter a bank turn. This is why you pull G's when you enter a bank turn. So this illusion is called the straight climb while in a turn illusion. So if the bank becomes prolonged, and you'll notice that's becoming kind of a theme here, if the bank becomes prolonged, the resultant GZ vector can trick your proprioceptors into thinking you are climbing with a nose up attitude. So almost exactly the same thing that we were just discussing. The only difference here is that because you are banked, your GZ vector points in that direction that you can see right there. And because, like, it's kind of hard to tell here, but it's also kind of pointing back away from the aircraft anyway. So that's going to make you feel like you're climbing even though you are not. So next, let's talk about what's called the G-excess illusion. So pulling G's will cause greater movement of the otolithic membranes in the utricle and saccule, which will intensify the feelings of head tilt while under these gravitational strains. So basically the idea here is take everything that we have talked about so far with the movement of fluid in the vestibular apparatus and how it causes us to feel that we are moving in a particular direction. And basically, the idea is that if you do all that while pulling G's, then the feeling gets magnified several times over. So pulling G's will cause those otoliths to move even more than they otherwise would. So it's going to intensify those feelings of head tilt while you're pulling G's. So for example, if you're pulling 1G, which is to say you're not really pulling any G's at all, if you tilt your head back 30 degrees, you're going to feel like you're tilting your head back 30 degrees. But if you tilt your head back 30 degrees while you're pulling 2Gs, well, those otoliths are going to get pulled in this direction more than they otherwise would by a 30-degree head tilt. So you're going to perceive more like a 50-degree head tilt because the extra gravitational strain displaced those calcium carbonate crystals more than they otherwise would. So the feeling of pitch and bank may be inaccurate while you're pulling G's, and this may cause you to make incorrect control inputs while you're pulling those G's, which can lead to an undesirable aircraft state. Okay, next let's talk about what's called the inversion illusion. So again, this has to do with pulling G's. So in this illusion, the resultant vector from pulling negative GZ but positive GX. So the idea here is that you're leveling off after a steep climb, which we know that when you first level off, you start pulling negative G's and the blood kind of comes up towards your head. So we talked all about that in the previous chapter. But if you're doing this while also correcting a bank, you're pulling positive G's in the X direction. So this can actually create the false sensation of the body being inverted when it is not. So you might feel like your body is upside down even when it is not. And this has everything to do with the resultant vector from the negative GZ and the positive GX. So the overcorrection from this can put, again, the plane into an undesirable aircraft state, in this case, a dive. Okay, and finally, let's talk about the oculogyral and oculogravic illusions. So again, these are the ones that have this kind of unfortunate synergy with the visual illusions that come from flying at night or without visual references. So as we've talked about many times so far, most of the previously mentioned vestibular illusions are easy to overcome if you have outside visual references available. But some of the visual illusions can be induced by vestibular or otolithic activity. We can actually see things that are not really there because of what's going on with the vestibular apparatus. So these illusions can either manifest as objects in the field of vision appearing to rotate when they're not, those are the oculogyral ones, or moving linearly in your field of vision, those are the oculogravic, when they are not. So some examples of these are, number one, the elevator illusion. So this is the result of either an updraft from a thermal underneath your aircraft or a level off from descent, enhancing downward gravitational acceleration, which creates the illusion of a nose-up attitude due to downward movement of the eyes. So it's just kind of natural that when something like this happens and you get pulled upwards, you have this feeling of wanting to look down. So when you do that, you have this feeling of moving upward but moving your eyes downward. That produces this unfortunate effect of feeling like your nose is up, even though the feeling of being pulled up is just because of lift generated by the wings rather than actually climbing because your nose is pitched upward. So the opposite can be true if you're dealing with a downdraft or a level off from a climb. Second, we have what's called nystagmus. So this is the body's natural reaction to spinning motion, is this involuntary back and forth movement of the eyes, which can delay recovery from unusual attitudes or spins, even though this is a natural automatic reflex that the body has, and it's intended to provide the brain with optimal visual information to get your sense of orientation established very quickly, or to prevent blurring of the scene and allow for quicker recovery. But in reality, when you're flying an airplane, nystagmus is actually kind of a detriment because it makes reorienting yourself much more difficult. So if your eyes are moving back and forth, it's going to take a few seconds for you to really kind of get your bearings and be able to look at your instruments and make decisions as to what to do with your flight controls. Okay, and next we are going to classify spatial disorientation. We can do it in 3 ways. First, we have type 1 spatial disorientation. This is called unrecognized spatial disorientation. In this case, the pilot is unaware of their spatial disorientation state and will base all of their control of the aircraft on false perceptions of attitude. So this is spatial disorientation before you even know you are disoriented. In type 2, which is called recognized spatial disorientation, the pilot is aware something is wrong and may initially suspect the problem is with the instruments, okay? So this leads into what we call disorientation stress. You start feeling like, uh-oh, something's wrong, and you don't know whether the problem is with you, you don't know whether the problem was with the airplane, and this creates this stress because when you go through this training, you're learning how dangerous spatial disorientation is. So the stress that comes with this can be difficult to manage, and basically, again, the takeaway is that you need to trust your instruments. That's not to say instruments can't fail, but you need to trust your instruments over your own senses, okay? So disorientation stress can be difficult to manage, and many pilots can struggle to trust their instruments over their vestibular senses, even though the vestibular senses are much more likely to be fooled. And then finally, you have type 3 or incapacitating spatial disorientation. In this case, despite the pilot being aware of the disorientation, they cannot overcome those disorienting symptoms to regain control of the aircraft. So that may sound like a really big problem, but we will talk about that when we talk about strategies for overcoming spatial disorientation right now. So again, number 1 takeaway, trust your instruments. That's why I have it in capital letters and big red text here, trust your instruments. So proper scanning and usage of the flight instruments will give the pilot an accurate depiction of the aircraft's orientation and attitude, even without visual references, okay? So the likelihood of instruments malfunctioning is actually extremely low. It doesn't mean it can't happen, but it's not a typical thing that's going to happen. It's much more likely that your sense of orientation, your vestibular, your proprioceptive functions are going to be fooled than the instruments being bad, okay? So instrument malfunction, extremely unlikely, but it does speak to the importance of doing routine maintenance and pre-flight checks and in-flight checks on your aircraft to make sure that everything, especially the instruments, are functioning correctly. You want to maintain instrument flying proficiency. So just as with anything, every good thing, every good skill takes practice. So if you do a lot, even if you're instrument rated, if you're flying a lot of VFR, you're maybe not going to be looking at your instruments or relying on your instruments the way that you otherwise would. So if you know that you've got an IFR flight upcoming and you've been flying nothing but VFR lately, then practicing in a simulator might be a really good idea first, especially if your aircraft utilizes a glass cockpit. So when we say glass cockpit, we're really referring to kind of this modern interface that pilots and first officers deal with in their aircraft, where the kind of steam gauges that are classic in a lot of older aircraft are replaced with digital screens and digital gauges, which are a little bit trickier to use, trickier to maintain, and trickier to work with. But ultimately provide a lot more information. So if you know you're going to be flying with a glass cockpit, definitely good to practice that in a simulator first. I mentioned this next strategy a little bit earlier. You want to avoid drastic head movements when you're flying IFR. As we've seen, the lack of visual references makes spatial disorientation a lot more likely to occur, and getting those abrupt head movements going is going to get movement going through your semicircular canals and make you very susceptible to the Coriolis illusion. You also want to avoid unusual changes in attitude. We saw that pulling G's exacerbates illusory symptoms of spatial disorientation. And we talked about a lot of the same sorts of strategies for avoiding pulling G's back in Chapter 8. So if you're not a military pilot, if you're not a stunt pilot, don't do anything stupid that would cause you to pull G's, because that's going to make spatial orientation a lot harder to attain as well. Transition to instruments early. So if you know that you're going to be losing visual references, if you know you're going to be flying in the clouds, go ahead and start using your instruments now, even before you lose your visual references. So it takes a little bit of time to get used to using those instruments, to not relying on those visual references. So better to do that early rather than later. This goes without saying, but be careful at night. So we've seen countless cases in your textbook of airplane incidents that have happened because of night flying. So it stands to reason that flying at night is a bit more dangerous than flying during the day, and not just because of the lack of visual references, but because of the unique physiology of the retinal cells that we saw back in Chapter 6, right? So a combination of visual references and reliance on instruments will allow you to avoid both vestibular and visual illusions. Avoid VFR into IMC flights. So we kind of mentioned this earlier. If you know you're going to lose visual references, go ahead and switch to instruments early, but avoid even doing that to begin with. So don't, if you're not instrument rated, then don't take a flight in which you might fly into IMC conditions. So the lack of skill or knowledge of how to use the instruments should completely disqualify or preclude a pilot from even attempting to fly into IMC. So we learned at the very beginning of your textbook that a pilot that is not instrument rated, when they fly into IMC, they will lose control of the aircraft very, very quickly. It happens on average within about 3 minutes. And then finally, get instrument rated. So it's a very useful skill, and it will allow you to fly more safely in a greater number of settings and conditions and environments. So the skill and knowledge of how to effectively use your instruments and use the information that they provide is the best and most effective strategy for preventing spatial disorientation in flight. And this goes right along with the trust your instruments mantra. The best way to trust your instruments is to get rated on the instruments. Know exactly how to use them. Be well trained and well practiced on how to use your instruments. Get help. So it's extremely unlikely that all members of the flight crew will simultaneously be experiencing type 3 spatial disorientation. So even if they are, you can always rely on the autopilot to fly the airplane for you until you can kind of get your sense of orientation back. But if the autopilot's not necessary, if the captain experiences type 3 spatial disorientation, they may want to pass it over to the first officer to fly the airplane until the spatial disorientation goes away. Okay, so that's going to wrap up Chapter 9. Thank you so much for your attention. I hope you learned a lot. Join us next time for Chapter 10. I'm looking forward to it. See you next time. So